Usually, when we talk to many CALs, they ask, first thing they feel that feeding tube is unnatural. Taking food by feeding tube is unnatural. But ये अ, बहुत ही गलत स्टेटमेंट है, क्योंकि डाइजेशन जो है, डाइजेशन वर्क्स द सेम वे विथ फीडिंग ट्यूब एज इट डज व्हेन वी टेक द फूड बाय माउथ. हम खाना खाते समय जो, अगर नॉर्मल खाना खाते हैं फ्रॉम द माउथ, वो एंड डाइजेशन थ्रू फीडिंग ट्यूब बोथ आर सेम. We get the same nutrition. So it is not unnatural the way people and society portray. It is very much necessary for our pals, and at the right time we should get it done. So we should not have that idea or myth that feeding tube is unnatural. और डाउट बहुत लोगों को लगता है कि पेग ट्यूब प्लेसमेंट के बाद हम वर्क के लिए नहीं जा सकते हैं. ये भी गलत है. आफ्टर प्लेसिंग पेग ट्यूब दे कैन कंटिन्यू ऑल देयर एक्टिविटीज. वर्क पे जा सकते हैं. अगर वो लोग चल सकते हैं तो चल सकते हैं. मेरे पापा चल सकते थे तो पेग ट्यूब के बाद चलते थे. हम लोग उनको नहलाते थे. We used to do all activities. Only two activities we cannot do after peg placement is we cannot submerge in water, that is स्विमिंग पूल के अंदर नहीं जा सकते हैं, या टब में नहा नहीं सकते हैं, शावर ले सकते हैं, और एक पेट पे नहीं सो सकते हैं. दे कैन नॉट sleep on the stomach. Only these two things they cannot do after peg tube placement. All other things they can do. करवट ले सकते हैं, नहा सकते हैं, बाहर जा सकते हैं, कार में जा सकते हैं, आउट स्टेशन जा सकते हैं. हम लोग ये सब कर सकते हैं. और सब लोगों को ये भी बहुत डर लगता है कि पेग ट्यूब लगाने के बाद मैनेजमेंट बहुत डिफिकल्ट है, हम लोग को नर्स की जरूरत पड़ेगी. ये भी गलत है. केयर गिवर या कोई भी पेग ट्यूब के लिए ड्रेसिंग करना या फीड्स देना, ये सब घर के पर्सन्स ही कर सकते हैं. हम लोग को नर्स की जरूरत नहीं पड़ती है. We don't need a nurse for managing peg tube. Okay, we'll go to the next slide. अभी क्वेश्चन है कि when is a feeding tube needed? आपको क्या लगता है when is the feeding tube needed? Anyone can answer? Okay. Usually, we will see what is a swallowing problem. Then we will come back to this slide. ये है path of digestion. हम लोग जब खाना खाते हैं, when we eat food, first it passes through esophagus and then it goes through the stomach. This is our stomach bag. ये इसमें खाना जाता है, and then it will go to the small intestine, large intestine, and it will come out after the stool is passed after the digestion. So what happens when we have swallowing problem? This is a healthy swallow, where when we eat food from the mouth, the food goes into the food pipe. This is the food pipe. The arrow shows the food pipe, and this white part is actually way to the lungs. It can be called windpipe or trachea. Way to the windpipe and trachea. This part is the throat. So when we eat food through the mouth, can you mute yourself?
Or host can mute if it's possible.
Yeah. So जब हम लोग को swallowing problem नहीं होता है, जो भी खाना हम खाते हैं, whatever food we eat, it goes through the mouth and directly into the food pipe. यहाँ पे जो एक छोटा सा देख रहे हैं आप, एक छोटा सा मसल है ये. This is like small tongue. It actually closes the windpipe when we swallow. It is called epiglottis. And when we swallow and we have swallowing problem, this epiglottis does not close properly. वो भी एक मसल है एंड उसका एक्शन थोड़ा वो वीक हो जाता है, तो वो प्रॉपरली क्लोज नहीं कर पाता है. It will not close the windpipe properly. And when a person with swallowing problem or dysphagia, they try to eat, some small particles of food will go into the windpipe as the epiglottis is not closing properly. This is what is swallowing problem. Overall क्या होता है, अपने पाल्स को या लव्ड वंस के नेक के मसल्स काफी वीक हो जाते हैं, तो उनको नेक स्ट्रेट में रखना भी मुश्किल हो जाता है, स्वॉलो करना भी मुश्किल हो जाता है. ओवरऑल फॉर देम एयर पैसेज भी कम हो जाता है. सो ऑल दिस नेक मसल्स become weak, especially in the bulbar. When it is a bulbar onset, we see these symptoms in the starting stages only, starting stages of the disease only. So when we come back to when we need feeding tube, swallowing problem क्या है हमने देखा है. जब swallow नहीं कर पाते तो क्या होता है, frequent coughing and sneezing होता है. Why? Because our lungs are designed that only air can go in the lungs. Nothing else should go into the lungs. So if tiny particles of water or food try to enter the lungs, then we cough and we sneeze to get that out. Initially, when starting stages में होते हैं तो cough reflex बहुत अच्छा होता है. They cough and they get out all that food particles outside. But later on, they cannot cough so much. तो थोड़ा थोड़ा करके खाना micro particles या small particles, they will go inside the विंड पाइप और सांस की नली में वो चला जाता है. खाना खाते समय थोड़ा थोड़ा खाना या पानी वो सांस की नली में चला जाता है. दिस कॉजेस aspiration pneumonia. This is called aspiration, and the food has bacteria in it. That bacteria will cause pneumonia. It is called aspiration pneumonia. So if you see, the major problem all our pals face is pneumonia, aspiration pneumonia. एंड मेरे पापा को ही एटलीस्ट बहुत बार एस्पिरेशन निमोनिया हुआ था. एंड कमिंग आउट ऑफ दैट निमोनिया इटसेल्फ इज अ वेरी बिग टास्क. सो इफ वी हैव फीडिंग ट्यूब इन द राइट टाइम, माउथ से खाना खाने की जरूरत नहीं पड़ती है, तो फूड एस्पिरेशन कम हो जाता है, फूड एस्पिरेशन के चांसेस कम हो जाते हैं. सो व्हेन वी हैव टू गो फॉर द फीडिंग ट्यूब, वी हैव टू गो when there is a swallowing problem and there is fast weight loss, nutrition properly नहीं मिल रहा है, और खाना खाते समय काफी बार कॉफ कर रहे हैं, स्नीज कर रहे हैं. स्नीजिंग मतलब हिच स्नीजिंग मतलब क्या है? एनीवन कैन ट्रांसलेट? आई फॉरगॉट.
चीखना।
हाँ,
सीखना।
छींकना. छींकना, क्योंकि दैट इज अ रिफ्लेक्स एक्शन ऑफ द लंग्स. देन अगर कोई पाल्स 30 मिनट से ज्यादा ले रहे हैं एक रोटी या दो रोटी का खाना खाने के लिए, इसका मतलब भी है कि उनको swallowing प्रॉब्लम है. और हमें पेग ट्यूब उस टाइम पे, प्रेम सर ऑलवेज यूज टू गिव मी 3 important pointers. One is weight loss. We should see that weight loss should not be more than 10 kgs from their ideal weight. We should try to maintain the weight when they were healthy. And then if they are taking more than 30 minutes to finish the usual meal, that is also one indicator. And we also should take care that they are not having severe breathing issues. इसका रीजन मैं बाद में आपको बताऊंगी. इनिशियली जब किसी को swallowing problem होता है, we suggest them to go for the speech and swallowing therapy, where they will learn some tricks like chin tuck, like खाना को स्मूथली बना के खाना पेस्ट की तरह. अगर वो सब ट्रिक्स अगर काम नहीं कर रहे हैं, तो इसका मतलब है कि जल्द से जल्द पेग ट्यूब का प्लेसमेंट करवाना चाहिए. Consequences of not doing PEG on the right time. Many times वी हैव दोस इनहिबिशंस, और हमने फर्स्ट स्लाइड में जो डिस्कस किया है ना, वी थिंक दैट पेग इज नॉट नेचुरल, वी थिंक दैट इट इज वेरी कॉम्प्लिकेटेड, वी थिंक दैट इट इज डिफिकल्ट टू मैनेज। हम लोग पेग डिसीजन लेने के लिए बहुत मंथ्स ले लेते हैं। उसकी वजह से क्या होता है, वेट लॉस बहुत ज्यादा हो जाता है। बहुत ज्यादा वेट लॉस जब होता है, इसका मतलब है मसल लॉस भी बहुत ज्यादा हो जाता है। एंड एक बार अपने पाल्स का मसल चला गया तो फिर से वापस नहीं आता है ना, इट्स वेरी डिफिकल्ट। सो वी शुड गो फॉर अर्ली पेग सो दैट वेट लॉस को हम लोग रोक सके, उनका प्रोग्रेशन इसकी वजह से इनडायरेक्टली कम हो जाएगा। वन वे टू reduce progression is proper nutrition, and another one is we will reduce the aspiration pneumonia. अगर हम लोग ने पेग नहीं करवाया तो वेरी मोर चांसेस ऑफ एस्पिरेशन निमोनिया। एंड ब्रीदिंग, अगर निमोनिया हो गया तो ब्रीथिंग इश्यूज भी इंटेंसिफाई हो जाएंगे। और एक बात क्या है कि हम लोग बहुत दिन अगर पेग को पोस्टपोन करेंगे और ब्रीथिंग इश्यूज भी काफी ज्यादा हो गए हैं, उस टाइम पे हम लोग एंडोस्कोपी नहीं कर सकते हैं। एंडोस्कोपी इज अ पार्ट ऑफ पेग प्रोसीजर। We have to first do tracheostomy and then peg has to be placed. So if we do peg placement before severe breathing issues come, that will be very easy for pals. That will give very good quality of life to pals. That's very important. Any doubts still here? Okay, we'll go to the next slide. This we already covered. This also we covered. So for the pre-procedure, we need to get some blood tests done. नॉर्मल सर्जिकल प्रोफाइल वाले टेस्ट, ब्लड टेस्ट करवाने होते हैं। पल्मोनोलॉजिस्ट हैज टू गिव क्लियरेंस दैट दिस पेशेंट कैन withstand 20 minutes of endoscopy without any BiPAP. That clearance has to be given by the pulmonologist. एंड नॉर्मल प्रिपरेशन हम लोग अच्छे से बात, हेयर वॉश सब करवा के, अच्छे से खाना खिला के, वी कैन टेक द पाल्स फॉर द प्रोसीजर। सो मिनिमम 8 hours ऑफ फास्टिंग इज रिक्वायर्ड, बिकॉज एंडोस्कोपी के टाइम में स्टमक में कुछ खाना नहीं होना चाहिए। मिनिमम 8 hours ऑफ फास्टिंग इज रिक्वायर्ड। टोटल प्रोसीजर, we should not give water for at least 3 to 4 hours before the procedure. Sometimes क्या हो जाता है कि pals get dehydrated very fast. So it's not mandatory to abstain from water for all the 8 hours. We can give water. Dehydrate हो रहे हैं तो we can give ORS or water during this 8 hours fasting period. It is very, very important to maintain the electrolyte balance. If we see in the test, there is a test called serum electrolytes. In this, we will know the values of sodium, potassium, calcium, and this chloride. And all these levels should be within the range. If they are not in range, we have to first balance them before the procedure. That is very, very important. And many times during this procedure, they keep the patient for long fasting. That also makes this electrolyte imbalance. इसीलिए पहले से ही हम लोग को बहुत केयरफुल रहना है, ORS वगैरह दे के रखना है। Even after the procedure, we should give ORS or coconut water, and we should also make sure that they are putting IV, saline drip or potassium drip as per the need. We should also keep BiPAP ready to use after the procedure if needed. क्योंकि procedure के time पे endoscopy करते हैं ना, that is very painful procedure for the pulse. It's not very painful, but it is discomfort for them for breathing and all. अगर उनको comfort चाहिए, they want to relax, then if we keep the BiPAP ready after the procedure, it will be very good. So time taken for actual procedure is 15 to 20 minutes, the PEG surgery. Including pre and post surgery time, it will take 3 to 4 hours max. It can be done as an outpatient thing. We need not admit the pulse in hospital. हम लोग morning जाके शाम तक और afternoon तक आ सकते हैं. Cost of the surgery is around 30,000 to 50,000 depending on the hospital. Endoscopy is done to send the feeding tube inside the stomach. Mild general anesthesia and local anesthesia is given during the procedure. हम लोग procedure का एक बार figure देख लेते हैं. This is not very clear, but ये क्या है? They will do endoscopy. They will send a pipe with camera and this feeding tube into the stomach bag in inner stomach, and they will pull the inner stomach. They will pull the inner stomach wall towards the outer stomach, and they will create a small hole and then send the feeding tube from that hole. So whatever food we will be giving, ये बाहर का area है. This is inside the stomach. This is a small stomach bag, and this is the outer stomach walls. So जो भी हम खाना देते हैं, that will be sent into the stomach bag. So this is the procedure. And it takes around 15 to 20 minutes. They will give local anesthesia and also mild general anesthesia, क्योंकि anesthesia ज़्यादा नहीं देना चाहिए. That will cause breathing issues. They will not be able to breathe properly. So that they have to give very mild. In my father's case, they gave very mild anesthesia that my father was awake within 30 minutes of the procedure. एंड ये 15-20 मिनट्स बहुत क्रिटिकल होते हैं. इस टाइम पे अगर ब्रीथिंग इश्यू अराइज होता है, they have to handle that situation. The doctors have to handle that situation. That's why we should go to a good doctor with the experienced doctor so that they can handle the situation properly. Very rare cases में peg surgery fail होता है when the doctors are not taking care of the breathing issue. And I think I have heard one case where Pals passed away, a young person in UK. In UK, he passed away during peg surgery because they didn't take care of his breathing issues during the surgery. So that's why we should keep the BiPAP ready. Yeah, we completed this slide. Okay. Post-surgery precautions and care. We have to do daily dressing of the peg site, and it is very easy. It's not a difficult task. We can just clean the site with betadine and put the gauze. We can share the video of how to do the dressing also. Many people have done peg and we can guide each other. Then we can give feeds every 2 to 3 hours, usually 6 to 8 feeds per day. They can continue eating by mouth also. So if they're able to eat by mouth, let them eat by mouth. And we can give the medicines and protein drinks through peg tube. Every day, at least one time flush should be done through, one time flush of the peg tube should be done so that it will not get blocked. And what we can give them is highly nutritious, concentrated feeds. We can give like dry fruit smoothie. We can give vegetarian feeds, non-veg food also we can blend and give. So all the feeds need to be blended properly and strained and given. We should avoid chili as it causes burning sensation in the stomach. And all the feeds we should give in inclined position. We should make them either sit or we should use inclination, like maybe hospital bed, 45 degrees of inclination to keep the pulse. And we also need to keep them in the same position for 30 minutes. The reason is the food can be pushed upside in the reverse direction and it can come into the throat and cause aspiration. Sometimes what happens is The food which we give in the stomach, it can come in the reverse direction and then it can cause aspiration. So that's why we should always maintain 30 minutes, maintain the same inclined position for at least 30 minutes. These are some common questions which we face. What to do when the peg tube is accidentally dislodged? देन अगर एक्सीडेंटली पुल हो गया और वो पेग ट्यूब बाहर आ गया, तो हम लोग को हमेशा एक पेग ट्यूब सेफ साइड रखना चाहिए, एंड वी शुड इंसर्ट द न्यू पेग ट्यूब एंड वी कैन एक्चुअली place it and give the air in it. So we will discuss it in next slide. How to deal with the situation when Pals has indigestion and want to vomit? If the if our loved ones is having severe indigestion and they want to vomit, there is very simple solution with peg tube. We can just open the peg tube and collect all the undigested food in any container and throw it off. So this should be done only when there is severe indigestion and they are getting feeling like vomiting. Okay. So we already discussed that after peg surgery, when the peg site heals, it might take 1 week to heal because it's a small surgery. After that 1 week or maybe 10 days, we can give bath. Till that, we have to do sponge bath. And pals can take side turn while sleeping. The procedure will be a little painful and the doctor will prescribe painkillers also for few days. But after 1 week, there will not be any pain. What to do if the tube gets blocked? So it is our care protocol that will help us that tube will not get blocked. We can have some uh, so many tips for blocked tube. Any suggestions from the group how to deal with a blocked tube? We used the cleaning
Bharti,
cleaning brush,
we can use
the
cleaning
steel.
brush, and
Yeah,
yeah, as Satminder also suggested, like सिलाई क्या बोलते हैं, that wool knitting
full
wool,
silai
that
needle,
knitting wool, that
knitting needles.
knitting needles, that also little bit to clean it. And normally to avoid blockage, we regularly after every feed we have to flush at least 80 to 100 ml water, slow by slow, मतलब by 20 ml 20 ml, so that it will get cleaned the whole feed. And one thing, that surgery, after surgery, that hole is very small. Hardly it is 1 centimeter diameter, no? So no need to worry about the effective surgery. It's a simple procedure.
Yeah.
Yeah, one thing I need to ask during this is the point. When we talk about indigestion and vomiting, I think if a pulse have indigestion or vomiting, then that condition also we should avoid peg tube surgery, right?
No. This is after
No, this is you
peg.
discussed after.
Yeah.
One case we heard, no, like
Yeah. Yes.
or something. You can explain little bit so that people should know.
Yes.
If doctor insists, no, you can
Yes.
discuss that.
So when
Thank you. I like to add here, Anjali has about the cleaning side. जो हम पहले करते थे in 2010, 11 and all those years, कि जब ग्रुप नहीं था, और वैसे भी अगर हम ढूंढे गूगल पे भी, then there was no ऐसा कोई minute ब्रश उस टाइम पे अवेलेबल नहीं था. I tried all over in मैंने बहुत टाइम पे ट्राई किया था, but it wasn't found. Then I took that सिलाई वाला ऑप्शन, कि जिसमें सिलाई ही वो हमारी पेग ट्यूब के हिसाब से वो उतना है, और दैट नीड्स टू बी वेरी केयरफुल व्हेन यू डू दैट प्रोसीजर, अप डाउन, ये ना हो वो ब्रेक ही कर दे वो ट्यूब को. बट डोंट यूज सिलाई नाउ-अ-डेज, क्योंकि अब इस टाइम पे काफी ब्रशेस अवेलेबल हैं. कितनी बार हमारे ग्रुप में शेयर होता है, अमेजोन पे भी है वो ब्रशेस. आपको किसी ये जो यूटेंसिल्स की शॉप है उस पे मिल जाएंगे। आप बारीक ब्रशेस मांगो उनसे, वो बर्तन वाले जो बहुत बारीक ब्रशेस हैं, विद दैट ऑल्सो वी कैन यूज। वीक में एक बार उसको अप डाउन कर लो ट्यूब के अंदर एंड यूल बी फाइन।
The
So,
steel straw cleaning brushes.
हाँ, स्टील स्ट्रॉ, या थैंक यू।
So, um, and we can use that same even if the tube gets blocked. And how to keep the tube clean? We have to give water before giving the feed and also after giving the feed. So that helps us to keep the tube clean, and also weekly once we have to clean it with the brush. We have to keep it separately and very clean. We have to maintain all the utensils and all the things related to PEG in a sterile way. So we will wash all the utensils and clean them with drinking water and let them dry so that they are free from any bacteria and all. So these are types of PEG tube. The first tube is called Mickey tube. Is anyone using Mickey tube in our group? Is anyone using Mickey tube in our group? Mickey button tube. So in US,
I think
most
3 years back
US
there
and
was one person who used it. I don't remember it right now. 3, 4 years back there was one person who used, but not right now anybody.
in
Because
India,
doctors also in India don't
recommend
do
in India,
perform, because they don't regularly perform this surgery using this Mickey tube, that placement.
yes. So, but this is very convenient tube. It will not have any hanging part outside. It will be like a button, and they have to measure the stoma length. What is the stoma length? The 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 outer the width of the outer stomach and inner stomach दोनों को मिलाने से stoma length आता है. They have to calibrate it using some instrument and then perform this Mickey tube. पहली बार तो normal tube ही bumper वाला tube ही लगाते हैं. From second time onwards they can try placing Mickey tube. In the normal tube, which the first time tube, it will look like this. It will have a bumper inside and it will have a disc, external bumper or external disc. And this is the tubing clamp and this is the adapter. Adapter मतलब यहाँ पे हम लोग अपना feeding syringe को यहाँ पे हम लोग connect करते हैं. आप यहाँ पे देखेंगे तो ये outer stomach के इतने सारे layers हैं. We have skin, we have fat, we have muscle, और ये inner stomach का region है. So all these things इतना लंबा अंदर रहता है. When they make the hole, मैंने ये भी सुना है कि when they make the hole, they call it pull method. They pull the inner stomach towards the outer stomach and then create that hole and place the feeding tube. That's why it is called endoscopy, placement of peg using pull method. और एक चीज क्या है कि एक बार जब होल बनाते हैं और दोनों को पास में खींचते हैं, both of them also get attached. So inner stomach and outer stomach get attached at that point. यहाँ पे जब होल बनता है वहां पे जब वो हील होता है, they both get attached. So that's why वी शुड नॉट बी सो मच अफ्रेड. अगर वो बाहर आ जाता है तो हम लोग तुरंत फिर से नया फीडिंग ट्यूब लगा सकते हैं. हम हमारे पास घर पे एक एक्स्ट्रा ट्यूब इमरजेंसीज के लिए हमेशा रहना चाहिए. सेकेंड थिंग इज ये मिक्की ट्यूब जो है इसमें एक्स्ट्रा हैंगिंग पार्ट ऑफ द ट्यूब नहीं रहता है. इट्स लाइक अ बटन एंड वी कैन क्लोज एंड ओपन द बटन. Whenever we are giving feeds, there will be an attachment. We have to connect the attachment, which is a long pipe, and then connect that attachment with the feeding syringe. ऐसा होता है. This is very convenient for people who go to work and all. वो बिल्कुल दिखेगा भी नहीं कहीं पे भी. जो बाहर लटकने वाला जो पाइप है वो किसी को ड्रेस में या कहीं पे भी अटकने का चांस नहीं रहता है। यूएस में, यूके में ज्यादा मिकी ट्यूब यूज करते हैं। देर इज अनदर टाइप कॉल्ड BRT ट्यूब, दैट इज balloon retention tube, right, Satvinder?
Balloon replacement tube,
रिप्लेसमेंट।
BRT.
हाँ,
Yes.
फर्स्ट टाइम जब हम लोग पेग सर्जरी करते हैं तो हम लोग को ये बम्पर वाला ट्यूब लगाते हैं। अंदर से एक बम्पर रहेगा विच विल होल्ड द ट्यूब फ्रॉम कमिंग आउट। ज्यादा जोर से पुल करेंगे तो वो बाहर भी आ जाएगा, बट यूजुअली इट विल होल्ड इट प्रॉपरली इन द प्लेस। वंस ये ट्यूब हम लोग 1 year to 2 years तक, हाउ वी मेंटेन द ट्यूब डिपेंडिंग ऑन दैट, वी मिनिमम 1 year, मैक्सिमम 2 years तक हम लोग फर्स्ट वाला ट्यूब रख सकते हैं। इट विल नॉट कॉज एनी प्रॉब्लम। फॉर माई फादर वी यूज्ड इट फॉर 1.5 year. Satvinder, I think Satvinder sisters had used for 2.5 years the first tube, and that is the longest I know. After we after that 1 year period, or when that tube is getting डैमेज्ड और उसमें थोड़ा सा क्रैक हुआ है, या वो उसमें से फूड ठीक से पास नहीं कर रहा है, इट इज बिकमिंग वेरी layers of food form हो गया है, we want to change the first tube, we can replace it with BRT tube, balloon replacement tube. In this, this will be placed externally. जो पहले वाला हम लोग ने देखा है वो एंडोस्कोपी के द्वारा, internally we will be putting the tube. Internally, we will send the tube from the food pipe to the small intestine, sorry, into the stomach, and then we will make the hole and we will place the tube from inside. But the BRT tube we will put from outside. So what we will do, we will just place the tube from outside into the hole, and this balloon initially it will not be inflated. We have to give NS or distilled water into this, इसमें ये ब्लू वाला जो है ना, दिस वन, the right bottom corner is the BRT tube. It has 3 openings. One is for feed, one is for medicine, and one blue one is for sending distilled water. So we can send the distilled water, नहीं तो NS भी दे सकते हैं, 20 ml of water we need to give, and this tube will be stuck inside. It will not come out. So there are 3 types of PEG tube. Any doubts here?
I just want to add only कि जब BRT ट्यूब मिलती है तो आपको साथ में सिरिंज के साथ वो पूरा वो भी मिलता है, मतलब डिस्टिल वाटर भी मिलता है, which will be used to inflate that tube.
We used to buy
20
big tube
20 ml का मिलता है उसमें,
tube. हमें
20
नहीं
ml
मिला था।
मिलता है, and technician they came na, normally they are having 1 ml 2 ml extra thing, so we also keep that in case we feel it is loose or something, we also add, but it's risky, so better 20 ml. अच्छा, आपने परचेज किया था बाहर से?
My technician gave NS only. He did not give
Oh,
distilled
distilled
water.
water, हाँ distilled water different. In that particular tube na, BRT tube, it is already in that pouch, it is already given.
Okay. In for some brands they do not provide.
Maybe. Hmm.
Okay. We'll go to the next slide. So these are the precautions. We always keep the extra tube for emergency handling, avoid infection, maintain hygiene. So whenever we are giving feed, we have to wash our hands. We have to maintain that hygiene care, proper hygiene care for the pulse, and also the caregiver who is handling all the things, they have to also be hygiene. Don't overfeed. This is very important. So we talked about the reverse flow of the food, right? So usually we should give 200 to 300 ml of feed. That will be enough. If we give more than 300, there is more chances of food going in the reverse direction. So as per the need, we usually give 200 to 300 ml of feed during every meal. Okay. First time peg tube can be changed after 1 year. If we manage it properly, we can go up to 2 years. We can change the peg tube after 2 years. Then after we place the BRT tube, we need to change the peg tube every 6 to 8 months as per the condition of the tube. And also we should make sure that this peg tube won't get pulled accidentally. So this also we have to be very careful. We can tape it, or we can use rumal. We can take care that take proper steps so that it will not be pulled accidentally.
Or I like to add here, with Bharti, you just shared ki what are the cares thing when we should not, the tube should not be pulled. How we can just monitor that is, जब जिस दिन वो लगी है, just monitor, click the picture and note it down somewhere in the diary कि वो उसका कौन से बार पे, वहां पर ना आपको बार्स नजर आएंगे ट्यूब में,
हम फोर
A1 M1 2 inches and
फोर पे
all that.
रखते हैं,
उस बार
फोर
को,
पे रखते हैं।
हाँ, उस बार को नोट करके रख लें, क्योंकि 4-5 दिन बाद या 2 महीने बाद आपको याद नहीं रहेगा कि अच्छा ये यहाँ पर था या यहाँ पर था. सो दैट विल बी वेरी हेल्पफुल फॉर द लॉन्गर पीरियड ऑफ टाइम कि वो नोट करके रख लिया जाए. और 1-2 महीने में एक जरूर अपना एक शेड्यूल बना लो कि हमको वो चेक करना है, सो दैट वी मेक श्योर कि कहीं बीआरटी अंदर से लीक तो नहीं हो गई और ट्यूब थोड़ी पुल हो गई है, विच वी आर नॉट एबल टू आइडेंटिफाई. अभी नहीं समझ पा रहे, हो सकता है 1-2 दिन में कोई इमरजेंसी ना आ जाए. सो वी शुड मेक श्योर कि हम वो नोट करके रख लें, वो जब लगी है उसके 10-15 दिन बाद तक, कि कहाँ क्या पॉइंट पे वो आपको नजर आ रहा है उसका पॉइंटर.
या
वो चीज.
यहाँ
थैंक
पे हम लोग अगर देखेंगे तो ये बीआरटी ट्यूब पे वी हैव द लाइंस, दीज आर द bars. So depending on the thickness of the outer stomach and inner stomach, ये कहाँ पे कहाँ तक दिख रहा है वो हम लोग को नोट करके रखना चाहिए. That is what Satvinder is saying. So if we keep a tab on that, we will know, and we are not doing any और हम लोग emergency situation में land नहीं होंगे. That is one good care protocol. यूजुअल कॉम्प्लिकेशंस जो हम लोग फेस करते हैं बहुत, जब मैं पेग सर्जरी के बारे में पता कर रही थी, विद इन आवर ग्रुप एवरीवन वर सेइंग दैट बहुत इजी है, इट्स अ गुड थिंग फॉर डैड, एंड एवरीवन वर encouraging to go for peg. But when I talked with outsiders, they created lot of fear in me. They said इन्फेक्शन हो जाएगा, लॉन्ग टर्म नहीं, अच्छा नहीं है. They said n number of reasons. But what my father was on peg feeding tube for almost 4 years, and he did not face any problem. In fact, he was so thankful for the peg feeding tube. पहली बार जब हम लोग पेग करा के जब घर लेके आए थे पापा को, पापा was saying मुझे एक मंथ पहले ही करा लेना चाहिए था. Last 1 month was very difficult for me. I was coughing to eat even small bites of food. सो वो जो फियर रहता है कि पेग फीडिंग ट्यूब अननेचुरल है या उसके बाद बहुत कॉम्प्लिकेशंस होते हैं, दैट इज टोटली रॉन्ग. हम लोग सिंपल केयर प्रोटोकॉल फॉलो करेंगे रेगुलरली कंसिस्टेंटली तो ये सब प्रॉब्लम नहीं होगा. फॉर वुंड इन्फेक्शन क्या हो जाता है कि कभी कभी ये जो आउटर डिस्क है ये दब जाता है और उसकी वजह से वहां पे वुंड होता है. तो प्रॉपर ड्रेसिंग एंड प्रॉपर चेकिंग हम लोग रेगुलरली करने से अगर थोड़ा सा भी वहां पे स्क्रैच हुआ या स्मॉल कुछ भी हम लोग को दिख रहा है, इमीडिएटली वी हैव टू टेक केयर ऑफ दैट वुंड. देन इट विल गो ऑफ वेरी सून. वी शुड, that care should be there. We have to observe the smallest things and we have to take care of it immediately. Then we will keep all the difficult things at bay. डिफिकल्ट सिचुएशन नहीं में नहीं पड़ेंगे. फिर बहुत
Vijay, can
sometimes,
you? I'm sorry. I
yeah,
think somebody's just raised the hand.
yeah,
I
yeah,
think
yeah.
by the name of iPhone. Can the person
Anyone?
unmute them and we
Yeah.
can?
Hi.
Can you?
I
Yeah, please.
Thank you. Actually, I'd texted that on the chat also, and someone, Vinith has replied. So I wanted to know if the
Okay.
BiPAP could be, yeah, I mean, my husband is already on BiPAP when he sleeps at night or in the daytime also, whenever he sleeps, because horizontal, he cannot breathe properly. So if in endoscopy or this PEG thing can be done.
Yes, it can be done.
Thank
They have to
Yeah,
be,
yeah.
yeah.
In fact, the see when you do the first time change,
uh,
like my wife underwent PEG and tracheostomy, and then a year and a half later, when they were removing the first PEG and then putting the BRT type of PEG, an endoscopy was done, and she was on 24 by 7 BiPAP. So it's just that you have to be a little careful. That's all. The doctor who is performing, if he is careful, then he can continue. The endoscopy is done, and BiPAP is also running at the same time. So it doesn't interfere as long as you're very careful.
Thank you so
Yeah.
much. So did you just say that this PEG thing is not just once, you have to keep doing it?
See,
Did you
PEG,
just?
the first PEG, when you do the PEG, right, as
Uh-huh.
Bharti mentioned,
Uh-huh.
the first PEG, it lasts between 1.5 years to, in rare situation like Satwinder, he can drag it to 2.5 years. In my wife's case, we did it after 2 years. So, but after that, you replace it with BRT. And the BRT replacement is kind of very straightforward. It's not a major issue.
Uh-huh.
So, in fact, the last time I did it myself. So, but don't try to do it without your experience. So, it can be done at home, and it takes only like 5 minutes. And
Uh-huh.
so BRT replacement has to be done at least once a year or at least once in 18 months. So that has to be done, and it's a very simple procedure. In fact, there's a special guy in Delhi, Mahipal, who will come and do it for you, and he's a very experienced guy. It's not a big problem changing the
I live
peg.
in Bangalore. I live
Yeah,
in
yeah.
Bangalore.
Well, if
See,
you're willing to pay him the airline
uh-huh.
charges, he'll come to Bangalore also.
Oh, nice. So
Yeah.
this Mickey tube also has to be done once in a year,
No,
I
no.
mean, once a year
Yeah,
or once
yeah.
in 2 years?
Yeah, see, the Mickey tube is a new technology that has come. I think a few people in India may be using it, but normal procedure in India, the first tube is the standard, the disc tube, which basically has to be done the very first time because initially the tube can come out very easily and so on, and that can create problems. So the disc tube is normally used the very first time when you do PEG. But after the first replacement, you can change it with BRT or any kind of fancy tube that you want.
Yeah.
It's not a. In fact, some of the kids in the US, their tubes are it's like a Mickey tube, and even the mothers, they keep replacing it all the time. So it's not a major issue.
Yeah, Mickey
Yeah,
tube we also can change. Mickey tube
yeah,
and BRT tube, even
yeah.
the caregivers can change. But with
Mhm.
supervision and with proper sterile, they have to maintain the proper procedure. That is very important. So coming back to your question
Thank
that
you. Yeah.
your pulse is using BiPAP during the nights and while lying down position. So
Mhm.
yes, my father was also using BiPAP only in sleeping position when we went for the PEG surgery. And they will use oxygen supplementation.
Mhm.
And I think that can be managed. But if
Okay.
PALs become dependent on BiPAP and they are using 24 by 7, it happens after like few years when they become dependent 24 by 7. At that point of time, it's difficult to do peg surgery without tracheostomy. Then they will do first tracheostomy. They create separate air passage through the trachea, that is tracheostomy, and then they do peg. So it's always better to go for peg prior to tracheostomy. Early PEG will give quality of life to pals. They will not lose weight. They will, mm, the progression is indirectly reduced and it really helps them.
Okay. Thank you so much.
Yeah.
Can you please share your name also? There was one
Anu.
person who shared iPhone and
Anu.
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 Anu
Yeah.
from?
Bangalore.
Okay, thank you, Anu.
Thank you.
And prior to you, there was an iPhone. I can see the name of that person is iPhone. Can you rename it, please?
Yeah, I'll do that.
Okay, thank you.
Yeah, so the complications which usually arise after PEG is like there might be wound or infection, there might be leakage. I'll start the slideshow. There might be leakage from the stoma. Some small food might come out from the stoma. Then there might be granulation. Granulation is actually it's the extra tissue which is formed while healing of the wound. So this granulation, it will stick to the tube and the stomach wall. This will come in between the tube and the stomach wall, and this will cause problem. Usually when we have a wound, some black color thing will form, and the slowly this wound will get um, our wound will get healed. That process, in that process, that black color things is forming, right? That is actually granulation. But when granulation happens at the stoma, it will connect both the tube and the stomach wall. That is problem. So we have ointments like QT soft, which we, if we apply for 3 days, the granulation will be gone. It will not be a problem. And then accidental tube dislodgement can happen, which we need to handle. Either we can place the PEG tube or we can call the OT technician to place the tube. And there is very rare complication, which is called buried bumper syndrome. This happens when, I'll show you in the picture. This happens when this inside bumper, internal bumper gets pushed into these layers. This happens very rarely. That's why we have to keep a tab um, on the bars of the tube. So this happened, I think, only to one family in our group. From Kerala, we had one family and they faced this issue. So that if we don't notice it in time, and if it is left like that for a long time, it will cause infection from inside. So that is the big problem. So we have to take care of that also.
And in our case, I like to add, while we are discussing what are the kind of complication, in our case, because we kept on continuing the first tube for 2.5 years, and we could see a little breakage at the bottom. So when the person, the OT technician, Mahipal ji, was taking that out, the inner portion, the disc, where goes inside the, मतलब वहां से break हो गया और वो intestine में चला गया, means stomach से वो intestine, and it was advised कि immediately I spoke with surgeons out there, and prior to मतलब having that procedure, because he shared कि ये complication आ सकता है कि वो बीच में break होके वो नीचे वाला portion नीचे चला जाए. जैसे हम ऊपर से तो हम BRT लगा देंगे, बट अगर वो नीचे वाला पोर्शन नीचे चला जाए, तो दैट, as per the surgeon, I consulted 2 or 3, they said you need to abandon the procedure and ship the patient immediately to hospital in that case. But in our case, we were very adamant ki, and mama was also adamant ki we will not go to hospital. So we took a chance कि जब महिपाल जी ने वो जो ब्रेक हो गया, वो अंदर चला गया वो पोर्शन डिस्क वाला, he said कि keep on giving, ये चांस ले सकते हैं हम कि keep on giving right food, keep on monitoring. जब भी रोज पॉटी या फीकल मैटर जो पास हो रहा है, तो हम उसको क्लीन करते थे डेली और देखते थे. एवरी टाइम वी वर डूइंग दैट इन द पैन. तो 8th डे इट वाज आउट. So we were very happy. So that kind of complication, I means we gave that kind of diet कि जहाँ पर वो smooth रहे, so that will move. और हमेशा ही एलिवेटेड रखते ही थे, बट उन दिनों में हमने थोड़ा सा ज्यादा ही एलिवेटेड रखा था. बॉडी को, सो दैट कि वो नीचे पुश करता हुआ बॉडी के बाहर निकल जाए वो, क्योंकि नहीं तो अदरवाइज अगर वो फंस जाए किसी इंटेस्टाइन के पोर्शन में, so that can lead to a lot of risky situation. So make sure you change the tube at the right time so that you don't fall into such complication.
Exactly, Satvinder. I heard from you. So this is also a precaution to take, not to linger 2 years. If 1%, 2%, they have already done that, but it's advisable to keep changing after 1 year or 1.5 years. The first tip, and second, जो BRT वाला भी 6 to 8 months, not more
Correct.
than 8 months. So because क्योंकि फूड इतना वार्म फूड जाती है, फिर एसिड ये सब स्टोमक में फॉर्मेशन होता है, तो कहीं ना कहीं उसका इफेक्ट तो होता है, तो इट्स बेटर टू रिप्लेस राइट टाइम।
हाँ, बट ये है कि वही 1 और मैक्सिमम 1.5 साल तक ले जाए उसको, और वैसे भी फ्लश इन जब स्टार्टिंग ऑफ द फीड एंड एंड ऑफ द फीड जरूर करें, कि जो उसकी लाइफ बहुत इंक्रीज करेगा, और मिल्किंग करते रहें, और ब्रशिंग वाला जो उसको क्लीन करने वाला जो वीकली एक प्रोसीजर करें, जैसे एक ट्यूब का
हाँ
क्लीनिंग
वन
का,
हाँ
तो
एक
आप
तो
यू कैन टेक इजीली 1.5 years, बट बियॉन्ड दैट बी केयरफुल, तो
वो
जितनी जल्दी
हमारा
हो
जो
सके।
एक्सपीरियंस था, वो नर्स कैसे भी हुआ निकल गया था। इट वाज इवनिंग, तो आई जस्ट वांट टू शेयर, इवनिंग टाइम था और हम डर गए, एंड द होल वाज नॉट सीन क्योंकि जस्ट हाफ इंच और 1 सेंटीमीटर का रेडियस का होगा। बट थैंकफुली हम हमेशा घर में वी केप्ट एक्स्ट्रा BRT ट्यूब, सो दैट इन केस ऑफ इमरजेंसी, वो महिपाल जी अगर आ भी नहीं पाते हैं, हमारी ग्रुप में वीडियो कॉल करके, या महिपाल जी जो OT टेक्नीशियन है, हम वीडियो कॉल किए क्योंकि इवनिंग टाइम था। थैंकफुली इज सो नाइस, वो OT में थे, बाहर आके उन्होंने वीडियो खुद पर्सनल वीडियो कॉल अगेन किया, एंड मुझे सजेस्ट किया हाउ टू देन, आज पर हिज इंस्ट्रक्शन आई जस्ट फॉलोड द इंस्ट्रक्शन, एंड मैंने इंसर्ट किया था लाइक प्रेम पुत्र सर, उन्होंने भी रिप्लेस किया, बट रिप्लेस मैंने नहीं किया, जस्ट इंसर्ट द BRT टिप एज पर हिज इंस्ट्रक्शन, एंड जो भी उन्होंने बताए थे 4 इंच के नंबर पे रखना, एंड डिस्टिल वाटर जो साइड वाला पोर्शन वहाँ पे, उसमें पाउच में था 20 ml डिस्टिल वाटर दिया, एंड नेक्स्ट डे उनको बुलाया। तो ऐसे कंडीशन में हम इमरजेंसी के लिए कर सकते हैं, एंड बाद में OT टेक्नीशियन या हॉस्पिटल में जैसे भी। बट इट वाज नाइस, फिर हमने पानी रात को भी दिया था आफ्टर 2 आवर्स, सब कुछ इट वाज स्मूथ। It was just an emergency. We should not get panic, but we can handle
Yes,
it.
we should not become panic. That is the
Okay.
main important thing while taking care of pulse.
हाँ,
Any
और
time, any situation, we should not panic.
एंड ऑल्सो जब एकदम से अगर कभी निकल जाए, एक्सीडेंटली डिसलॉज हो जाए, तो इतना मूव ना करें वो स्टमक वाली एरिया या उसको, क्योंकि स्टोमा डिस्प्लेसमेंट अगर वो काफी टाइम तक स्टे रहता है, अगर आप उसको वापस उसी होल में डाल दो, जैसे नेक्स्ट वाली ट्यूब होल में डाल दो, एंड देन वेट फॉर अ राइट हेल्प लाइक अंजलि हैज
हाँ,
डन कॉल
immediately
टू,
you have to insert
या
that
फिर कोई और
with
किसी को
with
बुला के,
वो
जो भी
sterile
है।
gloves। हाँ,
हम्म,
immediately आपको वो करना है, हिलाना नहीं बॉडी को, क्योंकि वो लेयर्स जो है इंटेस्टाइन और ये हो सकता है डिसलोकेट। राइट।
See, dealing with PALS, one thing everybody has to remember is that anything that you have there, including your different devices, always have a duplicate, always ready, so that you don't know which one you will use. So always have a duplicate of almost everything, including in fact, BiPAP, I keep telling everyone, even if you have uh, the duplicate, it doesn't have to be very expensive. The most inexpensive BiPAP, you can keep it as a duplicate, so that in case of a major problem, you don't have to run around and find the duplicate. So have everything, suction tube, your BiPAP, uh, all the devices that you will need, keep a separate unit ready to go, including your PEG tubes.
Yeah. Till here, we have finished PEG tube, but we have still one more topic. That is the Riles tube or the feeding tube through nose. So we'll quickly go through it. And we will also see the advantages and disadvantages of both Ryle's tube and PEG tube. So what is Ryle's tube? So for the Ryle's tube, we will be passing the feeding tube from the nose and it will go into the stomach. So it is going from the nose into the stomach. The feeding tube that goes from nose to stomach is called the Ryle's tube. And there are 3 types of Ryle's tube. One is PVC tube, silicone tube, and this was prepared by Ravi ji. If you remember Ravindranath ji, this this notes was prepared by him, because I don't know more about Ryle's tube. So he has given us the even brand of the Ryle's tube. Polymed Romson's and Polymed is good plastic Ryle's tube, and for polyurethane tube we have Freeka. And this one can be kept longer. It can be kept for 1.5 months. And the PVC tube or the plastic tube needs to be changed in 3 weeks. So here in Ryle's tube, we can give feed by gravity or we can push through syringe. Since the tube is very long, in the Ryle's tube, the length of the tube is very long. So there is more chance of food sticking to the tube, and we cannot even see what is happening inside. So that's why they say that if we give the feed, we push through syringe using the plunger, then the tube always is clean. So even if we give food through gravity, we should give water. Water should be pushed through syringe so that the tube is kept clean. So if we follow that procedure, the tube can be used for longer period of time. So if we push the feeds using syringe and plunger, then we can use Freeka tube for 2 to 2.5 months. Otherwise, we have to replace it in 1.5 months. Every time when we change the Ryle's tube, we will change the nostril. Like if we have placed it in the left nostril, next time we will place it in the right nostril. So placement procedure is very simple and it can be done at home. Any trained nurse or technician can place it easily. And it will take maximum of 5 to 7 minutes. And they have to follow the whole sterile process. Items required will be Ryle's tube, sterile surgical gloves. Then there is a jelly called Locks jelly, which is local anesthesia. It will give local anesthesia, plus it's also a lubricant. So we will apply it while placing the tube. We will need a tape to properly hold the Ryle's tube in the place, and we need feeding syringe. So for the care protocol, the feed should not be hot. And for the Ryle's tube, the tube will be thinner than the PEG tube. So the feeds have to be properly blended and strained and filtered. Even for PEG tube, the feeds need to be blended well and strained and filtered. But for Ryle's tube, it is utmost important. Even small particles will not go. So we have to take care of that. We should also avoid sticky foods like paneer or dahi or too much of fat, like ghee and all. If it is warm, fine, but we cannot give hot food. And if it gets solidified, it will be a problem. Also, powdered medicine can block sometimes. So we have to take care of that also. Here also we have to keep the patient in inclined position while giving the feed and maintain that position for at least 30 minutes. And we should also take care that air should not be passed through the tube. So that will cause gastric problem to them. So we should be careful that we are only sending feeds and we are minimizing the air which is going into the stomach. One important thing is while placing the Ryle's tube, because we are passing the tube from the nose, there is a chance that the tube might get into the trachea instead of the food pipe. So we have to be very careful, because if we put the Riles tube and it goes into the trachea and we give food, it is very dangerous. So we should very carefully put the Riles tube, and also check by giving air with the syringe. When we listen to the sound of the air, this the technician or the nurse will know. Even Cals from our group, like Harsh and some others, have learned how to place the Riles tube themselves for their pals. Harsh Kashyap does it for his mom. So we can learn it ourselves, and we can place the Riles tube also. But we have to be careful that the tube is going into the stomach and it does not go into the uh, windpipe or the trachea. This is very important. And we need to tape the Riles tube to the nose so that it does not, the position doesn't change, and it is properly in place, and it will not stimulate the nose, which causes a lot of mucus. And this is the length of the Riles tube, which we insert inside, 150 to 160 centimeters. The silicone tube, I think, is very long, and we can put more of the tube inside, and that is really helpful for some of the pals who had aspiration problem. Advantages of Riles tube. So sometimes what happen is we unexpectedly any pals get pneumonia or some infection, and during that time they temporarily develop breathing issues. During that time, it's better to go for Riles tube, but because we cannot go for PEG during that pneumonia phase of time. And it can be inserted at home by trained nurse, so we need not go to the hospital also. And it is a temporary tube, so after that pneumonia is over, we can remove it. And it is very cost effective. So we need not spend for PEG. PEG should be always planned. We cannot go in emergency and ask, we need PEG surgery. But Riles tube is something we can go in emergency situation. So everyone should know that if they are not able to go for PEG, or suddenly a situation arises where they need feeding tube, they can go for the Riles tube. What are the disadvantages of Riles tube is that we need to change the Riles tube every 3 weeks if it is a plastic tube, and every 1.5 months we have to change it if it is a Freca tube. And longer tube, it is a longer tube, so there is more chances of blockage, and it has to be inserted very carefully. And those who are using BiPAP in non-invasive way, for them, one of the nostril gets little blocked, so that causes breathing issue. So they feel inconvenience. In our group, there are many pals who were on Riles tube after tracheostomy for very long. Like Ravindranath ji was for 9 years. Indrapreet's mom was for 5 years. So Riles tube is also good option if they cannot go for PEG. If there is any complication and doctor is saying that PEG is difficult, or they don't want to go for PEG, that is fine. They can use Riles tube also. But after tracheostomy, they have different way for breathing, right? They have the tracheostomy tube to breathe through. That time it becomes, the disadvantages of Riles tube become lesser. The breathing inconvenience goes away. So that's when long-term people have used Riles tube. Any points to add? Any doubts?
Vijay, am I audible?
Yes.
Hey, hi everybody. I'm Hari Vishnu. I just want to add one point for Riles tube, because my father was also on Riles tube for quite a long time. So uh, people with Riles tube, right? They'll always feel something is going in their head, right? So it's an additional extra particle going inside the nose, right? That discomfort will always be there. they over the time they'll get used to it. That's one of the reasons like people would recommend to go for peg also. But again, like it has its own advantages as well. Like one less of a surgery, like easy maintenance. Not easy maintenance, I would say maintenance. Right, I think both are same, but very cost effective. As Vijaya mentioned, right, like people who cannot afford peg, right, trials tube is a very cheaper solution. Like every month probably you might need two or three if if you are using the basic one, and then even if you are going for the advanced one like Freka, like it'll not cost more than 800 900 rupees. But the catch is like make sure like the technicians in your city or town like are kind of okay with the material we are using. It's not only about the technical aspects of the things, but also the practical things, right? Our nurse, right, she was not comfortable like with Freka tube. So she was okay with the first two kinds of tubes, but she was not okay with Freka tube. And then things like this, right? And then couple of practical things again on Riles tube, right? Always try to remove the if you are planning to replace the Riles tube tomorrow, right? Do it the first thing in the morning. The previous night, you remove the Riles tube so that one night the calves can stay without any tube. After the last feed, you can remove that, and then the first thing in the morning, you can place the Riles tube. I mean, make sure you are shaving. I mean, if it's men, right? Make sure you are shaving. What do you say? Shaving
Learning.
schedule, and then this, yeah, so that you can click some pictures without the Riles tube, right, along with the family. This is what we used to do because those things are also important. And then one more practical thing I missed, if Vijaya mentioned it here. Always place the Riles tube in the deep fridge for 5 minutes. So that it's a little stiff before actually inserting it. Right. That's the initially we didn't follow that, but Ravi suggested that we follow this so that it will be easier to insert. Right, so always make sure that I mean these are like general practices followed but are recommended, but nurses, like when they do, they don't actually follow this judicial I mean religiously. They just do it casually, right? Always try to place it like 5 to 10 minutes in the deep fridge. And then one problem with Riles tube which we faced is, right, so whenever we are giving medicine also has to go through Riles tube only. So the tablet, if there are like if there is a precipitate of the tablet, right, that might be slowly being released in the stomach, right? That might cause unexpected reactions. Like for example, in our case, it was causing like diarrhea for my father. Like it was causing motions. We didn't whatever we didn't work out. But then Ravi suggested to change the Riles tube. So and when we removed the Riles tube, so there was like a good amount of tablet precipitate in the end of the Riles tube. So so such things, right? So make sure. I mean, if you keep on frequently changing, this might not be a problem. But then when we are changing it for 45 days or 60 days, right? So these things are a couple of practices to follow.
Excellent point, Hari Vishnu.
Yeah.
You brought
Very-
so many practical things
Yeah.
connected together.
We
So
can
we'll
jot down this.
update,
We
add
are
this.
very
And
we can jot down.
all of us, what we have to remember is we have to observe and learn. In this journey, we have to observe the smallest things and we have to learn. Otherwise, this journey becomes very, very difficult. I believe Satvinder and Sukhvinder had done that in initial first 3 to 4 years. They observed every small thing and then they learned and they have taught us all these points. So that is very important. Self learning is very important. Yeah, going to the I think we covered disadvantages of Riles tube. Now coming to advantages of PEG, there is no need of frequent change of the tube, and we can use it for long term, and we can give thicker feeds through PEG than Riles tube, and it does not cause much inconvenience to the pulse. Like once the peg site is healed, they will not even feel anything there. It will not pain or any inconvenience will not be there. Just that they cannot sleep on that stomach. Except that there is no other disadvantage. Yeah. My presentation is over here. We can have any questions. If anyone is having any questions, we can take them.
First of all, I must tell you, Vijaya, this is a great compilation of exhaustive information about PEG, which you have presented. Very well presented and very well documented. So, great. Thanks to you.
Thank you. Thank you.
Thanks. Thank you. Thanks a lot.
Thank you. It was really useful. Thanks.
Yeah, hello, hi. Can you hear me? I'm Shrikant Dev from Hyderabad.
Yeah, hi Shrikant.
Yeah, we can.
Yeah. So I'm new to this group. I've just been added about 2-3 weeks back, and my wife, she's been diagnosed with the bulbar onset ALS. So it's been, last March 2023, she's been diagnosed, though the symptom appeared in 2020, September, October. Now the condition is she's able to eat, but she sometimes chokes, and she's not coughing and all. She's able to swallow properly, but what is the right time to go for a peg actually? I mean, when is it right? I'm because she's not mentally prepared. I just referred this to her, but she was not mentally prepared to go for this. So, what kind of challenges do CALs face when we deal with insertion of peg? And what is the right time? When is the right time to go for a peg? Hello.
So are you doing any speech and swallowing therapy?
Speech therapy we did for some time, but she's not doing anything right now. But she follows the instructions given by the therapist from Nimhans. Dr. Yamini was there, suggested few things to take care of while eating or
Okay.
drinking. That's what we do.
Okay.
Nothing.
You should do speech and swallowing therapy. We can take 1 or 2 sessions and then continue what they suggest. There will be some exercises and some tips on
Okay.
swallowing, and we can
So,
do that. So if we
so
come
do
to
you
this,
have any sessions? Do you have any
yeah,
sessions on speech and swallow also?
yeah, we have one recorded session. We can plan one
Okay.
more. Uh,
Okay.
yeah, there, Dr. Hema from Bangalore, she took the session.
Okay. Oh, I've seen that video actually some time back,
Yes.
and that was very informative.
Yes. So my father used to do the exercises for almost 1.5 year, and that really
Okay.
helped him to
Okay.
postpone the need of PEG.
Okay.
And
After
I
after
can share,
diagnosis, when did he actually start this exercises? How long did it take for him to do the exercise after the
he was
diagnosis?
diagnosed in April, and I joined the group within 2 weeks. We were
Okay.
suggested this therapy, and probably in August he started doing that. Again, till
Okay.
August, it really helped. 1 year
Okay.
really helped.
Fine.
Um,
So these
What
are the
Vijay, I'd
documents?
main,
just like to jump.
Sure.
yeah.
Sorry. I'd just like to jump in here to answer Shrikant's question. Um, Shrikant, to be honest with you, earlier the better as far as PEG is concerned.
Okay.
And this is from our personal experience with our father. We were delayed by, well, COVID. The second lockdown was a big issue for us, and we
Okay.
were pushed back by 2.5 months. And
Okay.
a good rule of thumb is to monitor weight.
Okay.
Yes.
And if you start seeing weight dropping very quickly, and by quickly I mean, if you are dropping kgs by the week, definitely it's a
Okay.
very, very strong indicator of the need of PEG. Um, we feel that we could have done it earlier and we should have done it earlier.
the good thing about PEG is you don't limit oral feeding. Once the
Yeah.
initial trauma of PEG is, dealt with, you can continue oral feeding. In fact, you can, and my father also, for about 2 months after the PEG was done, for foods that he really liked to have or he wanted to have a taste of, he would still try and have some of it, using his mouth. But
Okay.
for the most part of nutrition, where it becomes a challenge, where it's a long process of eating, sitting at the table, or for that
Mm.
matter, where, some foods are difficult to chew because the tongue or the mouth muscles are
Yeah.
not supporting,
Yeah.
definitely start them on PEG. Perhaps you can
Okay.
even consider, if your wife gets to a point where she becomes comfortable with the idea of having the PEG, you can just use PEG as a tube to just swallow water, because food may still be easier to be swallowed. Water may not, because water slips
Correct.
through the throat, right? So,
Yeah.
your mouth muscles may not be able to take in water as easily. So
Okay.
definitely, you can use the PEG just to have water. Let her continue to have, food via the mouth, and then slowly build in the dependency on the PEG and wean off, the dependency on the mouth. That will give you
Okay.
that extra time. It will reduce the chances of, choking, uh, aspiration, or in worst cases, pneumonia. So
Okay.
definitely, I would recommend consider PEG earlier than later. I know it's a process. I know people don't want to come to terms with the idea of doing it, but in my experience, I think it should be done earlier.
Okay. Thank you. I didn't get your name.
My name is Gaurav.
Okay. Gaurav, so speaking about the weight loss, my wife was about 59, 60 last March. Now she is
Okay,
stable around 54. So do you
okay.
think, I mean, that is it considerable weight loss in this last 1 year, 6 months, or 1 year, 3 months, or is it okay? Because
I guess
she's
it would
doing
you would have to you might want to kind of cross-reference that clinically with an expert, maybe
okay,
somebody with nutrition background. For
okay,
us, what had happened was that our father was dropping a kg a week at the time
oh,
of
okay,
us getting PEG done.
okay,
And this was all through the second lockdown, and we were having a challenge to, find a doctor who would do the surgery. So
okay,
it got to a point where, he would just not enjoy having food orally. It was too much of a effort to be put into it. And then, as nutrition drops, weight drops, and it then affects your mood. It just affects your general well-being. So
correct,
yeah, I mean, there is no real rule of thumb. We took a
Yeah,
call
early
at
limit.
that stage,
Yeah.
and
okay,
we felt that it was quite late. We should
Uh,
have done it at least
Same,
a few months
Gaurav,
before.
same also, we had same issues. We also delayed for I think 2 months. So the drastical, we have seen loss of weight. When I when I entered into joined the group, and the first meeting we have in our home only. But that time we prepared, so you can prepare mentally. Okay, you have to go for peg tube or ALS tube surgery. You have to go for peg tube surgery. Now this is the time you can mentally prepare and discuss with technician, clinical, like doctor, surgeon, so that gradually she may get ready to it. So one point I actually I wanted to share with you, when I discussed with Barbara Ellis worldwide about this thing, what extra medicine supplements we should take, and how to delay the progression of the disease, and what are the suggestions, right, like that. The first sentence she told me, uh, the disease never leads to death. If you go to through this website or net, when you search about ALS, when you heard about ALS diagnosed after that, Pulse or Carls, we search through net, it everywhere mentioned 2 to 4 years life. lifespan.
Correct.
So, but the sentence I remember throughout my life, Barbara told me the disease never leads to death if you manage two things. One is nutrition, another is breathing, because it affect other part. It is like upper limb, lower limb, then we can manage the person. So only if you can manage breathing by invasive or non-invasive, whatever, BiPAP or ventilator, every support, that is one way we can manage breathing. And another is that aspiration, maximum time aspiration, pneumonia, whatever we discussed throughout this session, Vijay has already told. So many of our pulse, we in this journey with this our group also, we knew a few of we lost them, we lose them because they have not gone through PEG tube or RALS tube properly, and aspiration, due to aspiration only we lost them. So it is better to manage both of them. So PEG tube to manage, in addition to PEG tube or PEG tube, also with ventilator support, my husband continued to take feed through mouth till 6 months after ventilator support also. तो थोड़ा थोड़ा जो उनका फूड लैकिंग था, जिस चिकन का ग्राइंड करके, जो दाल थोड़ा स्मूदी बना के 1 1 स्पून, हाफ स्पून माउथ में लेते थे टेस्ट के लिए। डॉक्टर ऑल्सो सजेस्टेड कि टेस्ट के लिए आप थोड़ा थोड़ा देते रहो। अभी भी शायद प्रेम पुतुर सर भी कह रहे थे थोड़ा। लेकिन व्हेन योर वाइफ आई थिंक feel difficult for taking water or very liquid thing, then you can understand कि this is the time we should prepare up and gradually हाँ डिस्कस करके, क्योंकि वेट लॉस सडनली होगा, अभी तक वो गेन नहीं हो पा रहे मेरे हस्बैंड। जो लॉस हुआ ना, वो तो हम मतलब इट वाज डिलेड फॉर अस, इट वाज अ लेसन फॉर अस। प्लीज बी
Yeah,
श्योर।
like Anjali mentioned, once you lose the weight or you lose the muscle mass, I think it's in this condition, unfortunately, to gain back that muscle mass is very difficult. So
Okay.
it's all about maintaining where you are. That's probably the best thing that you can do. I know it's a difficult conversation to have with, your wife or whoever it is who might be suffering from this condition. I think it's very important to at least start discussing with the doctors. Maybe it's not a decision that will happen overnight. You can start a conversation, you can start discussing with them, see how the doctor can sensitize the issue with the patient. At least keep the doctor on call. Sorry.
Gaurav, one
Yeah.
question. By doctors, you mean the neurologists or the gastro guys?
Well, the neurologist doesn't really have much of a role to play here. Maybe
Much role in this, right?
They may want to give a go ahead, but typically, it's the pulmonologist who will say that fine, clinically you are okay to go ahead, and essentially a gastro who will, do the surgery. So
Okay.
you would want to start having those discussions and, bring them over, or if you can go to them and try to sensitize the issue and at least have somebody on call so that if you have to get it done, and again, this is a planned, procedure, but at least
Yeah.
that if your wife, whenever she's ready to have it done, say maybe in a week's time or a month's time or whenever it is, you've had that initial discussion, it's been discussed and decided on, and it's okay to go ahead. So at least that much preparation you can put in and be ready, uh, and kind of go through that procedure. Ideally, you would want to do this earlier than later.
Okay. Thank you. Uh, Thanks for all the feedback everyone has given, and the presentation was really informative, and it's kind of enlightening on how to deal with situation.
Yeah, mainly we have to remove all the misconceptions around the feeding tube and accept it. First, CALs
Okay.
have to accept it and then persuade the PALs. Not everyone would want to go for invasive feeding tube. So that is personal choice and we can respect that. But before coming to that decision, they should know all the pros and cons and why we should go for feeding tube. So that they can take the right decision. We don't want to force anyone to go for the feeding tube. At the same time, we want to give all the information so that they can take the decision themselves whether this will benefit them or not. In my father's case, we went for feeding tube when he was walking. Yeah, and he was doing all right. When we were in the hospital, the doctor and the nurses and everyone in the OT, they were thinking that my father is not the patient. Oh, is he patient? They were asking. So he was doing all good when we took him to the hospital for the peg tube placement, and it really, really, really helped him. So I want to stress that early peg is always good. Okay, I think any more questions, or shall we close the session for today?
We are already I think 90 minutes,
Yeah,
30 minutes above. Sure, we can have another session maybe after couple of months and have more of a query session once everyone have this inf ground, I think, information about PEG using this session, which we'll be sharing in the group, and then we'll take it forward from there.
Yeah, thank you for this session. And I would request that, like you said, if you can have a session on swallowing and the breathing exercise or whatever is good for the persons, because we knew here, though I have seen the earlier recording, but if you can have it on live once, so it will be really helpful.
Sure.
I
We'll plan it
I
soon.
agree.
Yep.
Yeah, thank you very much.
We'll have, I think,
Agree with that.
now
Yeah.
I got to know from your feedback that what is the next session we need to have, which is a swallowing session from a speech therapist. So we'll have that next.
Right. Thank you.
Thank you. Thank you everyone for joining, and be patient with listening all this information. I'm sure things would be well with every one of you. Have the right nutrition at the right time, get the right decisions of BiPAP and tracheostomy at the right time, and you can live a very longer and a very quality life, everyone. So leave about that perception 2 to 5 years. One can live 10, 15, 20 years as well. So thank you. Thank you, Vijaya Bharti, for preparing all this session and organizing. I think Gaurav and Vineet did a great job, both of you. Also in arranging and doing all these things, and every one of you. Thank you.
Nice session. Vijay
Thank you.
Bharti, really, you have made it बहुत अच्छा, very informative and well presented. So nice to discuss session like this.
Thank you, everyone. Thank
Thank
you.
you, everyone.
Thank you, everyone.
Thank you. Bye.